So for some time now, I have stopped giving health talks on some relevant issues due to some personal issues. I had some personal challenges which I thought it wise to figure out to solve before I could continue with my content. I am a content creator, and I basically talk about health, basically for the neonates and the children, because that's my specialty. I'm a pediatric nurse, so I advocate for pediatrics, I advocate for neonates, and I advocate for children. That's where I have passion for in nursing. So you guys, do you believe that at this time and at this age, people still opt for manual circumcision? I don't know the problem they are having. I don't know if it is ignorance, I don't know if it is misinformation, I don't know what the problem is, but at this particular time, someone somewhere is still opting for manual circumcision. You guys, we have two types of circumcision. We have the ring method and the manual method, which has been in vogue since the early 90s, since the 80s, the 90s. It has been in vogue, but now we have the ring method, which is the modernized method of circumcision, and it has its different advantages, and their advantages outweighs the advantages of the manual circumcision. You guys, the advantages cannot be overemphasized. So one of the advantage of this ring method over the manual method is that there are less bleeding in circumcision. Before, if you're using the manual method, you find out that the child bleeds profusely if the if it's not controlled, if the procedure, if the blood is not controlled, maybe by using adrenaline or by ligating the bleeding vessels, you get. So with the invention of this ring method, it helps the baby to bleed less. We call it even self a bloodless surgery, because the bleeding is very minimal, it's very mild, and it is also cosmetic, because that ring that is used in circumcision, it gives a very fine appearance. When the ring falls off, it gives a uniform appearance, it gives a uniform ring round that penis area, unlike the manual method, which is cut without guiding. But that ring method, if you're cutting it, you will cut round the ring, which gives it a uniform appearance. So these are the two major advantages of this ring method over manual method. So I don't think why someone at this age with this information will still be choosing the manual method over the ring method of circumcision. I hope I'm communicating. So if you have a male baby, or if you're carrying a male baby, and when you put to bed, when you visit the hospital for circumcision 7 to 8 days after delivery, you should specifically tell them, that you are opting for the ring method. They should not do the manual method for you. They should do the ring method of circumcision for your child. Okay? All right. Thanks and bye. I see you in my next video. Bye.